The second wave of COVID-19 has proven fatal to India. The unprecedented rise of cases is toiling with the existing infrastructure. Frontline warriors are risking their lives, whereas the government struggles to provide the bare minimum resources to the citizens. Every sector is coming to a halt with no sign of infection decrease. Gradually, the states are going for a lockdown. Is that enough to solve the problem? The top government has announced that it will provide all the necessary equipment for every citizen, but the present scenario looks different. Individually, everyone is taking the utmost precaution. In spite of that, what will you do if you get affected? Yes, you should address a response team before going to the hospital. This is decentralized planning, where the problems are addressed at the micro level before it accumulates at the top level. Here are some steps to follow. Step 1. Develop the neighborhood plan. You can delineate the area based on street, neighborhood, or ward. A map of your ward is always available in the area councillor's office, or you can get it from the local office of law enforcement, firefighters, police station, emergency medical services, or the military. You can even make your own map from Google Maps or take the help of experts. Step 2. Develop the resource list. World Health Organization has shared a list of medical devices that are essential for COVID-19. Check out the link given in the description. Make a list of professionals present within the delineated area who can aid in this crisis, like doctors, vehicle owners, caterers, volunteers, etc., as public participation and awareness is the need of the hour. Step 3. Identify the affected areas. Go for house-to-house survey. Make a priority list based on the parameters like senior citizens, symptoms, comorbidity, etc., so that early attention can be given to these disease-prone areas. Step 4. Set up the Emergency Response Center. Following the previous steps, now at first, locate open spaces, park, community hall, school, or any public space where emergency center can be set up. Many public places are temporarily closed during COVID times. You can get permission for such places. Next, set up temporary camp with the medical resources and volunteers. Here the list of professionals and medical resources will come handy. Request the localities to provide any spare bed or vehicles they possess, which can be utilized during COVID times. Next, inform the local residents and local clinics about the setup and emergency call number. Try to connect as many people as possible, as this will encourage more community participation. Fourthly, go for regular monitoring. Regular vigilance and physical support can be a big aid during the hard times. Update the authorities for regular help. Take the help of local authorities and police to update about the current situation of your locality. Providing correct information to the experts can save from a greater disaster. Repeat these steps as long as your locality needs. No one will be able to prevent a severe pandemic from coming to your locality. However, you can play a key role in leading your locality through the pandemic and reducing the number of deaths by having an organized disaster management system. Always maintain the individual safety protocols and then take the community level initiative for you and others. Stay safe and spread the awareness.